is the major public health issue in the world right now, and the major cause of death in India is TB.
Private practitioners has got a very big role in the National Tuberculosis Control Program. 80% of the patients' first point of contact is the general practitioner or the family physician who has to do the initial diagnosis.
Once the patient is diagnosed with TB, the common thing they face is social marginalization of the patients, and because of the financial deprivation, they don't continue the treatment regularly. Motivating them to continue the treatment for 6 months, that itself is a great problem for us.
So it is very important for the private sector health providers to understand that any cough and phlegm more than 15 days duration could be tuberculosis, and to be properly screened for tuberculosis. So that is one of the biggest challenges we face in the private sector. The problem lies with the patient also, because for the first 1 week of symptoms he goes to one doctor, then the next 1 week of symptoms he goes to the next doctor. So the cumulative period of delay in treatment is attributable to many doctors.
Most patients would not complete the treatment because of the simple reason of unaffordability. So now, and because of this REACH Equip program, I would say for sure that most of the patients who have been diagnosed as pulmonary tuberculosis have completed the course with much ease, receiving a lot of benefits, not just by taking regular drugs and close monitoring alone, but also through the add-on facilities, which they are currently enjoying.
To achieve TB control in India, it is very important to involve the private health sector. REACH has been closely working with the private health sector since 1999.
Project Equip, which is enhanced use of quality drugs and utilization of innovative diagnostics in TB management by private sector, was implemented over a 1.5 year period in South and Central Chennai.
This project has been designed in close consultation with private practitioners, chest physicians, general practitioners, and leading TB experts.
It has created a unique model of hubs, the Equip centers, where private-public and private-private collaboration is possible. And these are called the Equip centers, where patients are referred for diagnosis and getting treatment.
Project Equip has been very helpful for us. Being a private hospital, we do get patients from the low socioeconomic class. So, and the other problem is availability of tuberculosis, anti-tuberculosis drugs is not that easily available outside in the pharmacies. So one is the diagnosis, the other one is the treatment. Both ways they helped us, because expert TB, the test that we do for diagnosing tuberculosis in a short duration, is not easily available in the other labs outside. It's available in a few labs in Chennai, but it's very expensive.
The private practitioners also came forward to provide a space in their hospitals, in their hospital premises, to function as a center for TB care services.
The Hindu Health and Welfare Center has been functioning as a PPM for several years, offering TB diagnostics, counseling, and also treatment for patients suffering from tuberculosis. This gene expert test is such a big boon to all these patients who cannot afford to go to private labs, and it is offered at no cost to these patients. Ever since this gene expert was installed in the center, we've been seeing increasing number of patients referred by private practitioners, and a large number of patients are being benefited by this facility here.
The Gene Expert MTB assay is a cartridge-based automated test that not only detects the presence of TB bacteria, but also detects resistance to the rifampicin drug. This test is completed within 2 hours' time. So the major advantages of the Gene Expert test are the test report is ready very quickly, it is highly sensitive and specific, minimal technical training is required to perform this test, and one added advantage in our lab is that we perform it free of cost. Rapid diagnosis with the Gene Expert test therefore helps TB patients to be started on treatment as early as possible.
Patients receive services like counseling on drug adherence, monitoring of treatment, risk assessment and nutritional support. As part of patient care services in EQUIP, we had a team of dedicated field officers who were working at the grassroots levels in providing TB care services for the patients.
I wanted to do my bit for the society, and I found this is one of the best platforms to do it. So I decided to give my space so that REACH could do their marvelous activities from my center.
Through the support of the interface NGOs working in these centers, all patients in the project were notified, and for more than 90% success rate was achieved, which is higher than the global target to end TB.